My name is Gregory Sims. I met Dr. Fuller through my heart doctor in Douglas for a carotid artery. The location of my blockage was under my jawline, and his procedure of doing the stent was much less invasive than open surgery. I was very interested in his procedure, especially with the reverse flow of blood for blood clottage. The surgery was about an hour procedure. The recovery overnight was in ICU ward for backup in case something should happen. The staffing requirements there were 1 nurse per 2 patients, which I very much enjoyed that. The care was very competent, very attentive, very pleasurable.
So I'm Dr. Tim Fuller. I'm with the Heart and Vascular Center at Tift Regional, and just want to talk today about the TCAR procedure. TCAR stands for Transcarotid Arterial Revascularization. Long word, but it's really for a neat procedure. What we're able to do is take the gold standard for fixing carotid stenosis, which is the carotid endarterectomy. That entails a pretty good sized incision along the neck. More substantial surgical intervention as far as exposing the artery, a lot of times clamping or shunting the blood flow to the brain on that side, which in itself can have about a 3% risk of stroke. One of the new technologies that we've been able to bring here to Tift Regional is the TCAR procedure. We're able to make a small incision right above the clavicle. From that incision, we can pass a wire past the stenosis, or that narrowing of the artery to the brain, and able to deploy a stent to really open up that artery and provide blood flow. Again, the advantages of the procedure are less dissection up here in the neck, much smaller incision, and because of the flow reversal that the system provides, it actually brings any plaque or debris that might be, knocked off during the procedure and actually funnel it through a catchment device as opposed to causing a stroke. Normally in the past, anyone who had these high anatomical risks, had prior carotid endarterectomies, or were high risk from a medical standpoint, we would often refer these patients out of the region to Emory or to Macon to get this procedure done. What's great now is our local community can have this procedure done here. And despite the fact it might be a high lesion or they've had prior intervention before and a high-risk patient, this procedure allows us to still take care of them here.
Dr. Fuller is very competent. He's very enthusiastic about his work. It was a pleasure meeting him.